It was within the first couple of years of my working at the University of Minnesota Medical Center, and there was a young man in his early 30s who was an attorney, and he developed a very, very aggressive cancer and was going to have a short time to live. He had a 2-year-old, and his wife was pregnant, and I was a part of their experience for 3 months, and his goal was to live until his baby was born. His baby was born, and he died 2 days later. And the moment that is so poignant for me was he was lying in bed dying. His wife was on one side holding his hand. His nurse was on the other side, along with his mother holding his other hand. And I was standing at the foot of his bed holding his 2-day-old baby. As he died, it was the most poignant experience I've ever had.
She worked with people experiencing tremendous existential conflicts or angst, going through cancer treatments, and some patients who were dying, trying to find hope. And Doretta was just instrumental in helping those patients.
It's a patient and family allowing you to be with them in the most intimate, personal time of their lives. And I have always felt that I learned more from the patients and families with whom I worked, and it feels like a privilege.
She started a whole array of programs, things like way back when she started a wig donation program. She's started a support group for breast cancer survivors. She's done just a ton of work around patient education, around resources for folks with cancer, and has done a lot of work in mentoring social workers. She was also instrumental in initiating and building a nationally recognized palliative care program to help bring comfort to patients who are struggling with end-of-life issues and pain control.
I also belong to the Association of Oncology Social Work, so I'm able to attend those conferences and be an active part of another way of teaching new oncology social workers from around the world, which has been just a great privilege.
She is sort of the epitome of that goodness and kindness and supportiveness and being open to what the patient needs. It was fascinating watching her work, just how well she did it.
I was so afraid when she retired. Excuse me. I didn't know what I would do without Doretta's support and guidance to keep going. And what I didn't realize was that Doretta's voice was in my head, and I could keep using her wisdom and her advice. And when I need her in my work, I think about what would Doretta do, and I feel this little angel who helps me out.